So, doctors and other health workers are being seen as healthcare service providers, and many times the English has been changed to refer to patients as clients also, and we provide. However, the hospital has some peculiarities, and doctors do also have some peculiarities in which we might make some very unpopular calls that might be outrightly strange or offensive to you as a patient, but they are the right calls at the moment. In today's video, I'm going to list and explain 5 of these calls that are unpopular, but they are the right calls to make in these different scenarios. So if you happen to be someone that witnesses that, it will help you not to get offended, because at this moment, just understand that a good hospital and good health workers will always make calls that are for your benefit as a patient. If you're new to this channel, please subscribe and turn on the bell notification. To my returning guys, thanks a lot. So let's dive into today's video. The first one is that sometimes we might not follow the first come first serve basis to attend to patients. We always follow that for the sake of orderliness and fairness. People are seen based on how early they came, but sometimes we might skip some patients that come earlier to attend to others that come later, and this only happens when the ones that come later are in dire need of the doctor more than those that came earlier. It happens. However, we wouldn't do that without letting you know that there's somebody that needs us, or there are some people that need us at this moment, and we have to skip you to attend to them. And it can be offensive, especially if you had waited for a long time and you're about to see the doctor and the doctor skips you to attend to someone else. Please bear with us. We would explain that most times. So yes, if there's an emergency, we would have to attend to the more stable cases than the stable cases. This usually happens in a clinical setting. So in a clinic where everything is stable, we usually run that. Forgive us if a doctor happens to do that. Instead of just being angry or offended, you could just walk to any of the hospital staff and ask why. If you could also meet the doctor, politely do so. We wouldn't deliberately skip you for somebody else that come after you without no genuine reasons to do that. The second is similar to the first one, but this one is usually in accident settings, and it happens in cases of mass casualties. There's something we call triaging. Don't be surprised most times that very good doctors in these cases attend to the victims that are quiet first, while ignoring those that seem to be shouting in pain or anguish. It's surprising, yeah, I know, but being quiet is usually an indication that the person might be in more serious danger and does not have the strength or the energy to shout. So they might quietly be dying. Whereas those that are shouting usually is an indication that they have enough energy. If you have been in the hospital settings before, there are some people that do not even have the strength to shout or scream in agony. These are things we consider, especially in surgery or doing some certain painful procedures, that even if the patient happens to be unconscious, we still give analgesia to the patient, because the person not shouting does not mean the person is in pain. So yes, we will skip those that are shouting, because we believe at those moments they do not need urgent attention as much as those that might be quiet. So we'll assess the quiet ones first and see whether they are really stable and just not in severe pain, or they're slowly dying. If you happen to be skipped in these settings, to understand that we're using our clinical acumen to triage properly and reduce complications as much as we can. Then the next one is something that happens when someone is recently diagnosed. It doesn't necessarily mean that because you're diagnosed with a disease, you are started immediately on drugs. Most times, especially if it's not serious enough, doctors will recommend non-pharmacologic options for you first to see how your body improves that. So they might recommend dieting, exercise, or some certain activities that will help control whichever disease it is. So if you happen to be diagnosed with a disease and you see the doctor withholding drugs from you, it doesn't mean that he or she hates you or is being insensitive. The doctor will be able to explain properly to you why he or she is starting on the non-pharmacologic options. It's a partnership stuff, so you can discuss with your doctor too. The first one is a doctor referring you, or referral does not mean that the doctor or the hospital attending to you immediately are incompetent or less competent. This happens many times, that many of us think that the less competent doctors are being posted or work in smaller hospitals and the more competent ones are in the bigger or tertiary institutions. No, there are structures for healthcare facilities, and many times even if the doctor is good, because of how the hospital is being equipped, it might limit how far they can go in treating you. So many times we refer to the appropriate centers because they are properly equipped in terms of manpower and medical instruments too. So when a doctor is referring you, many times it doesn't mean that he or she cannot treat you, although yes, we refer when things are beyond our scope, but many times we might be able to do so, but based on medical ethics, we refer appropriately to the right people to handle you properly. So when you're being referred, please don't look down on the doctors or the hospital that referred you. It just means the people know the right thing to do. It's better you're being referred than somebody keeping you and attending to you for something that's not within his or her scope. Then the last one is really unpopular, especially for those that like comfort, is that many times the general wards are better to stay in than the private wards. Get me right, and this way more relatable in developing countries. In developed countries, private wards have some things that compensate for what is lacking in the general wards. And why this is so, why the general wards are better than the private wards, is that the general ward is where everybody is, including the health workers, so it's easier for it to be monitored. If there's any problem, prompt attempt is being made to be able to correct that. However, if you're in the private ward, it's easy for health workers to miss that. Although many developed countries, the private wards have whatever it can use to alert the health worker in case there's an emergency, but it's easy for it to be missed if you're in the private ward compared to if you're in the general wards. That doesn't mean that you shouldn't go to the private ward, you should, but in some certain cases, especially if you're not stable enough, private ward is not the best idea per se. And I'm speaking more in terms of developing countries than developed countries. So that's all for today's video. What do you think about the video? Let me know. Is there anything I left out? I want to know so that I can address it properly too. If you have any question, if you need any clarification, let me know. If you're yet to subscribe, please subscribe and turn on the bell notification. Don't forget to like this video. Don't forget to share also to as many people as possible. Thank you, and I will see you in my next video.